You're watching Local News 8 Newsline's COVID Special. Local people, local news.
Good evening, I'm Todd Kuntz. Welcome to our Newsline COVID Special tonight. We want this to be a very helpful and informative program for you, and we're glad to have you here with us. Several questions to get to that we've asked a couple of weeks ago. Throughout the last couple of weeks, you have sent us your questions. There's plenty of information out there, and we hope to get to as many as those we can to get those answers for you. To help us tonight, I want to introduce you to our special guests, our experts, our health experts. With me here on your left is Jerry Rackow. She is the director of the Eastern Idaho Public Health District in Idaho Falls. And here on the right is Maggie Mann. She is the director of the Southeastern Idaho Public Health District out of Pocatello. And I want to thank you both so much for being here with us tonight and get this information out to the public. We want it to be informative and helpful, and we are so glad to have you with us. Let's just jump right into it here, and I'm going to start with Jerry first. To get us launched into our topics, what is one thing that you want the public to know tonight? This is your way to reach them tonight. One thing you want them to know.
I would start by saying that we're all in this together. This pandemic has been scary. It's created a lot of uncertainty and a lot of confusion, and feels like a lot of things are out of our control. And I personally don't like that feeling. But we're all in it together, and there are some things that each of us can do, choices that we can make that can have an impact. We all want to get back to normal, and to do that, working together and making choices to do simple things that can maintain as much normalcy in our lives as possible, we're asking everyone to join with us to make that happen. Those simple things: staying home when you're sick, washing your hands frequently, wearing a mask when you cannot physical distance from others, and then physical distancing from others. Those simple things can have a huge impact on the outcome of this pandemic in our region.
Okay, so what I'm gathering from you, some sacrifices now, simple sacrifices for a quicker return to normalcy later. Okay, got that. Now,
that's right.
Okay, Maggie, for you, we visited with you just a couple of weeks ago, and Jerry as well, that there's a lot of misinformation floating around out there. What's one item of misinformation that you would like to dispel tonight?
So, Todd, that's a great question, and I would echo what Jerry's response was about a primary message, but when it comes to myths, there are two primary ones. First, the misunderstanding that this virus isn't a big deal. For many people, their symptoms are mild to moderate, but we know that for a certain segment of our population, and while it's somewhat predictable, it's not 100% so. People are having very serious health outcomes. In addition, the second myth that we would like to address is that masks or cloth face coverings are not an effective tool in helping to limit spread. So we know from a growing body of research that cloth face coverings are an effective tool in our toolbox to help limit spread of the COVID-19 virus, and that they do not cause health issues or more problems than they solve. So those are the two primary myths that we would like to dispel.
Okay, I'm going to tag on the back end of that because I do have a lot of questions here from viewers concerning masks, as you might expect. You've addressed a couple of those issues real quick. I'll just go through these so that our viewers know that we use their question. This one comes from, looks like M. Walker. Okay, I received this from my sister, who is not a nurse or an expert, but did work in and with medical radiation. She has now become an expert on masks. She says they're hazardous, they make us sick. Cloth masks do not filter anything and are good for nothing. We are much better off to go without anything, yet the CDC is telling us to wear them. You kind of touched on that, but cloth, does cloth filter out viruses like it does bacteria?
The short answer to that, Todd, is yes.
Okay.
We know that, I'm sorry, I'm having major audio problems. I can't hear anything that you're asking me, and I'm sure it's probably my Bluetooth headphones, but it's completely blocking in and out, and I apologize.
Okay, we'll see if we can get that fixed, and I will switch this over to Jerry real quick. Cloth masks, do they filter out and do benefit as like bacteria as well, and then as viruses as well?
Yeah, Todd, that's a good question. And I know it's been confusing, like I mentioned earlier, that early on in the pandemic, there was guidance from the CDC that we shouldn't wear face coverings or masks.
So
and,
the evidence that we have,
the reason for that is because there was a shortage of personal protective equipment, and we needed to maintain that for our healthcare providers. And also, the virus was new. Very little was known about it. And as time has progressed and more information has become available, it is found that cloth face coverings, or any face coverings for that matter, but cloth ones, do effectively prevent the spread of the virus to other people. And that's primarily because people can be infectious with the virus before they start showing symptoms. And that's why it's important for everyone to wear a face covering to prevent that spread of the virus to others unknowingly.
Okay. We had a story just a couple nights ago about one of the hospitals saying, yes, we need more time. The question was, do we know if masks are working? Do we see any data? And they said, use them, yes, but we would want more time and more data to come. And we are learning things as we go. And that's much what you just said with Dr. Anthony Fauci early on, saying masks weren't much help, and then they learned that they probably were much help. And so we're evolving as we move through this. We're going to take a quick break and address this audio with Maggie, and then we'll come back and get to more of these questions and see where this takes us with our COVID special here on Newsline tonight. Stay right there.
COVID special continues.
Welcome back to our Newsline special on COVID-19 tonight with my special guests, Maggie Mann, Southeastern Idaho Public Health District Director, and Jerry Rakow with the Eastern Idaho Public Health as the director of that district. We went into the commercial break talking about masks. Got a question here from some viewer. Rebecca says, can you teach people how to wear them properly? They do no good to cover your mouth only and leave the nose exposed. You see that a lot. They're wearing one, but it's somewhere down around the chin area. That kind of negates the purpose, doesn't it? Who wants
It does. Certainly respiratory droplets can come from both the mouth and the nose. And the masks are effective when they cover both the mouth and the nose.
So cover both. Keep it up there. Here's a question, serious question. Why are there no biohazard bins for used masks and gloves if this virus is so contagious and deadly? Makes sense. If we're using our cloth mask over and over and I take it off and put it in my car console or in my pocket and then put it back on, they need to be washed or disposed of. Maggie.
So that's a great question, Todd. So our recommendation is that when you take your reusable mask off, if you're not at home, if you could keep like a gallon-sized Ziploc bag that you could put it into and seal that off to store it. If you are at home, if you can take it off and either wash it by hand or throw it in the washing machine and wash it on the highest temperature possible and dry it on the highest temperature possible, that's what we recommend. The real risk of spread of COVID comes from breathing in those respiratory droplets, and that's unlikely to happen from handling a mask. It's not impossible, but it's much lower risk than, say, close contact with someone without a mask on.
Okay. For you, Jerry, this one comes from Monty. Comparing the COVID numbers in Idaho Falls and Jackson, since each of them made mask mandatory, are the numbers going down since this action? Take the numbers prior to the masks, and since they've been used, do you see it working?
That is a good question too. And what we're seeing in Idaho Falls and Bonneville County since we've implemented the mask order is our case counts are still growing. But we have seen in other areas where mask mandates have been in place that cases are leveling off. Part of that is because there's a 2-week incubation period for the virus, and so once a mask order were to go in place, it would take some time to see the positive impact of that. So we're hopeful that as more people become compliant with wearing the masks, that we'll start to see those cases level off.
Okay. Stay right there. We're going to take a quick break, come back with more of your questions on our Newsline COVID special. We'll be right back.
Your days are busy, and making time to sit down and watch local news can be difficult.
That's why KIDK Eyewitness News 3 is always on.
With the latest in local news and your full first alert forecast on either the KIDK Eyewitness News 3 app or at KIDK.com.
No matter when or where you watch your local news, KIDK Eyewitness News 3 is always on.
Find your keys. Find your get up and go. Find pants that aren't sweats. Find your friends. Find your sense of wonder. Find the world is new again. At Chevy, we'd like to take you there. Now during the Chevy Open Road Sales Event, get up to 15% of MSRP cash back on select 2020 models. That's over $5,700 cash back on this Equinox. See your Southeast.
And now, Local News 8's Newsline COVID special continues.
Welcome back to our Newsline special on COVID-19 tonight, answering some of your questions that you have sent to us over the past couple of weeks. To do that, our health experts, Maggie Mann, Southeastern Idaho Public Health District out of Pocatello, and Jerry Rackow with the Eastern Idaho Public Health District in Idaho Falls. Viewer questions here. Let's get to, how about this one? This comes from Lisa. Is there any information related to teachers and school staff being able to get tested before returning to school? So far, insurance is not covering it unless an individual is actually sick from COVID symptoms. That's a great question in general for anybody. You have to have a doctor's order to get tested, is that correct? Jerry?
Yes, Todd, that is correct. You do have to have a doctor's order to get a diagnostic test.
Okay.
The goal is at some point, and we're not there yet, to have enough testing availability to be able to do testing for people that are not symptomatic.
Okay,
but
so
in our
that's
region,
why the
we're
order.
simply not there yet.
Okay, so a person that, oh, I've been around somebody I've later found out got sick, I don't know if I've got it, I just want the peace of mind. The way it stands right now, a person cannot get tested in that situation because of limited resources, limited supplies of testing. Is that right, Maggie?
Yes, that's correct. As people have probably heard, on a national level, there's a really overwhelming number of tests being performed, and that has led to shortages of testing supplies, as well as delays in getting testing response or results back. And so we do currently recommend that only symptomatic people be tested.
Okay.
When it comes to teachers, there is a subgroup of the governor's testing task force that's currently meeting to talk about testing strategy for teachers, students in the school setting, that sort of thing. And they should have recommendations coming out next week.
Okay.
As far as insurance coverage, it really depends on an individual's policy, what will be covered and what won't be.
Okay.
And Todd, may I just add a little more to that?
Yes.
So the example that you shared, that someone may have been exposed and just want to get tested for peace of mind, is not really effective. And it goes back to the incubation period of the virus. At any point during those 14 days, someone could become infected and symptomatic. Just because it doesn't happen on day 5, and perhaps that's the day they went and got the test negative, it doesn't mean that tomorrow they won't convert to positive.
Okay, so you have to wait out the incubation period, be best route to take. Okay.
That's correct.
Good to know. Okay, stay right there with us. You stay with us at home. We'll come back with more of your questions on our Newsline COVID special.
And now, Local News 8's Newsline COVID special continues.
Welcome back to our special tonight on COVID-19. Our health experts, Maggie Mann, Southeastern Idaho Public Health District in Pocatello, Jerry Rackow from the Eastern Idaho Public Health District in Idaho Falls. Question here for you, Maggie. This one comes from, looks like David. What is the rationale for establishing 6 feet for social distancing? So 6 feet, let's go with a temperature of 100.4. Where do some of these numbers come from? Who establishes these?
So that's a great question. And those parameters are set by infectious disease physicians around the globe. People like Dr. Anthony Fauci, who has been working in infectious disease for decades and is truly an expert. So they take all of the evidence that they're able to gather and they start establishing parameters around what they've seen. So the reason that those guidelines have been sent is based on the evidence to date. One thing that it's important to note is this is still a relatively new virus, and so guidance and parameters may change. You may recall that symptoms early on were limited to fever, shortness of breath, and cough. Those have significantly expanded as we've learned more about how the virus presents itself in different people.
Okay. Last question for you, Jerry. A person comes from out of state, they get sick here. How are these numbers counted? Are they counted for this area as a sick case, or are they counted from where the person's from?
Yeah, we get that question a lot, Todd, and the numbers are counted by the person's county of residence. So in Idaho, we have someone that travels out of state and potentially contracted it there, but came back. It would still be counted in their county of residence.
Okay. I'm so sorry we're out of time. We have used every available minute of this of our special. We want to thank you both, Jerry Rackow with the Eastern Idaho Public Health, Maggie Mann with the Southeastern Idaho Public Health.
Thank you, Todd.
Answering these questions for the public. Again, Jerry, you told me we do this. We want the information out there to keep a handle on this so that it allows hospital capacity to do everyday hospital things and not be overwhelmed with this.
Yep.
So tons more questions. We know there's a lot out there. We only touched on a few of your questions. We thank you for those questions, and we thank you for watching tonight. Have a good night.